Okay, well, welcome back, everybody. I see everybody's joining. For volunteers that were recording, please stop your recording now. I have mine started, so we will definitely be recording this session. And once again, we're just going to be doing our feedback session. I've posted the codes for the Menti of each of the sessions in the chat. So please feel free to contribute to the conversation if you'd like, while each group is summarizing what they talked about. So I will invite the first group, Closing the Digital Divide Among Seniors, to talk about what they talked about. And I will share my screen right now with the information, and take it away.
Thanks, Christina. I'm going to try and summarize our discussion again. So when we talked about how seniors are impacted by the digital divide, we did talk about the digital divide as a spectrum. So starting with understanding what the digital divide is, it's not a yes, no, they have access to digital technologies or they don't. It's kind of a spectrum of seniors may have access, but may have varying levels of computer skills, ability to understanding of new apps, and so really making sure that we consider that in public health, as well as considering those who truly don't have access to computers, smartphones, and are not receiving information in a digital manner. Need to be there is an impact around, for those seniors that aren't accessing digital information, the transition of some foundational public health and health information to restricted to electronic media or online media, and keeping in mind how this can exclude older adults and other people. And also consideration of English as a second language or not a language for some older adults at all. And so particularly during the pandemic, this had significant impacts for some populations. When everything went online, registration for services, banking, and the assumption that everyone could access that and everyone could access it in the English language. And so this can compound inequalities. Other examples that came up: booking of COVID vaccine appointments, going online, applications for disability pensions, and how this can pose barriers. And similarly, taking into account some particular needs of seniors, although this could apply to any group. I think, if you're facilitating an online group, making sure that there's an appropriate volume for people who are hard of hearing, and just establishing group safety. So it's a safe place to kind of make mistakes and I guess, be yourself, because otherwise that can turn seniors off greatly. And then a general discussion around, and this came up in our first group as well, just the general discussion around not trying to replace human contact with technology, consideration of loneliness among seniors and how this can be impacted by the switch to technology for communication and contact. So in terms of public health strategies to close the gap, there needs to be more of a focus on policy and upstream, and that doesn't seem to be getting a lot of the attention it deserves from governments. We discussed some tangible examples of solutions, such as lending libraries. So using lending libraries to lend technology for those who don't have it or can't afford it. Really looking at this idea of lifelong learning and making sure that people don't get left behind as soon as they're done their formal education, whatever that may be for them. And making sure that in using assistive technologies or developing assistive technologies, we don't further increase the digital divide. Again, we can compound inequities and inequalities. Yeah, I think I'll end there, because that pretty much, I think, Lori, do you want to add anything? I think that kind of summarizes our discussion.
I think you did that beautifully, Sam. Nothing to add. Lots of work to do, nothing more to add at this point.
I agree.
Thanks, sir.
Okay, well, thank you very much. We're going to move right on to the next group, Better Than Same, Honesty and Equity. I'm going to present the first question here, and please, whoever is assigned to speak, start speaking.
My apologies, I didn't offer equity to the group and have someone other than me speak. Example of how not to do it. We had a very interesting discussion that got to very complex and deep issues very fast. We did talk about, there's so much bad history for many of the groups, their experiences with healthcare and with the systems in general are very poor. And if we don't understand, for example, vaccine hesitancy among Saskatchewan First Nations, we're not going to get very far. And so as we were talking about impacts, we actually began to talk about the strategies that emerged. And it seemed that the reality of impacts actually becoming barriers, they actually seeing the impacts as barriers that we actually need to address. So we were able to talk about quite a few different pieces. And very important, I think, was the fact that misinformation and disinformation were actually heightening the loss and the lack and the denial of equity, so that people were further disenfranchised, they were further isolated and more distrust, so that you could see the reality of impacts in a way that gets behind individuals just not wanting to learn, but actually getting into understanding specific populations and what were their barriers. So if we move to the next question, there was real concrete ideas that, as I say, I think harkened back to some of our principles in public health. So the capacity to understand and know a community's history and its past experiences, and being able to recognize the leadership and the trusted leaders within a particular population very much is about respecting the knowledge that people have already and building on the communication methods they have that already work. Recognizing diversity, a lot of problems if we're going to try and produce universal messages, because the universal in some populations is going to sound dictatorial and far too insistent. So how we find ways to speak our knowledge in a way that people can actually hear it. For example, an example was elders telling stories, and that feeding into a very strong traditional method where you teach across generations, grandparents teach the children. So finding ways that are culturally respectful and as a consequence more effective. You can see some of the ideas that really, we spoke mostly to Indigenous communities, but we also looked at the disabled communities. And this was an example of not homogeneous, that you can't assume that one group is going to have the same needs, or even perceptions of risk are going to be different. And those are things we have to know about. Sam, is that everything? Sam and Shannon, did I miss anything?
I think that was a beautiful job. Thank you.
As usual, your engagement strengths. And we assumed you were doing the check-in, as has happened in earlier sessions. So I just want to say it was not you not being equitable. It was you taking responsibility. So thank you and bless you.
Thank you, Shannon.
Tess, it's Denise. Can I just make
Yes,
a comment? Because one of the participants, I think, made a really important point around the first question.
Yes.
That question should be reframed as equity denied populations, because that respects the structural barriers for those populations, that they may be unable to actually seek equity.
Absolutely. And I don't know why I missed it. It's right here with a big star on it. Absolutely. And it's an example of how we think we're asking a good question, we're asking the right thing, and it's a question that actually doesn't recognize reality and isn't going to work. So thank you for that, Denise. I don't know how I missed it. It was my first point. Thank you.
Awesome. Well, thank you very much. And thank you, Denise, for that little reminder. If there's not any other comments for the better than same one, we will continue on to the last one. Are the kids all right? And I will invite you guys to speak to that one.
All right. Hi, everybody. Can they see me? Okay, cool. Okay, so our first question was, how are children and youth impacted by disinformation, misinformation, and news? So do I just... Okay.
Generally summarizing the conversation.
Okay, so we kind of started by talking about like where youth get their information and the best way to present it to youth. So we kind of talked about how people's attention spans aren't super long, and watching a 10-minute video on all the precautions you should be taking and how to get your vaccine probably wouldn't be appealing to many younger people. So just short, simple worded posts or simple worded things are probably the best way to get information out to young people, rather than sending out articles or anything that's pretty long and takes time to do. Mostly fast-paced things are best. What else did we talk about?
Yeah, we talked about
just about different ways of implementing information on COVID-19 and vaccinations into the classroom. And we went over how for teachers, giving them resources is great, but it's just another thing on top of their job that they have to do. And teachers already have a lot on their plate. So bringing someone in who has all the information and has personal experience with things is the best way of connecting with kids. I think we want to move on to that. There we go.
Oh, Kathy, did you want to speak to that at all? Because I know you had a bunch of great comments.
Yeah.
Oh, hi, can you hear me?
Yeah.
Okay, good. I apologize. I'm on a computer. The camera doesn't work, and I hadn't expected to be speaking, but I so appreciate what you were saying, Theo. So when asked about how public health could support youth in terms of digital health literacy, Theo had mentioned that getting information in schools from teachers or getting brochures and having a chance to talk with counselors would be helpful. So for me, who works with teachers across Canada, That's so good to know. And then there was a great question to Theo about if students would prefer to have information session discussions individually, small groups, or as a class. And whole class discussions seem to be a good way to start. And then breaking into small groups or students working with a partner works well. So that was very good to find that out too. And then students may appreciate the chance to express their own personal experiences individually and perhaps share with a partner or share more widely within a class if comfortable with that. So that I found that really helpful. And then following up on a comment that health experts could support teachers to provide information to classes virtually, as teachers are so busy, and this is a lot to expect from them for teachers to do that. And Theo confirmed that there are benefits from getting health experts into classrooms. So I was asking if doing this online works as well as in person. And there's certainly challenges to having a virtual presentation because it's so hard, it's so much harder to connect. So I asked about could students perhaps submit, and that would be privately, of course, anonymously, their thoughts. That would be so valuable to get insights and what kids are thinking if that was a safe environment. Yeah, that's
Yeah, that was amazing. Thank you.
Thank you so much.
All right. Was that everything?
Okay, that about covers us.
Yeah. I think that's about everything we talked about. Yeah, we talked a lot about the education system and just how to be putting good information into schools and supporting teachers and stuff. So I think that's all from us. So thank you, everybody.
I think we also stressed the distance learning because that's the kind of environment that we found, and I found that really interesting. How we talked about the counselor certainly coming in, but how that if it's distance learning, then you'll have to do that kind of online, and that's what Kathy was just talking about.
Yeah,
great.
Alrighty, thank you.
Thank you, everybody.